Let's talk about one of the toughest, most important skills in all of medicine. We're going to dive into how to have those really difficult conversations about uncertainty and risk without making everyone terrified.
So let's just start with this question. What if the hardest part of being a doctor isn't actually figuring out what's wrong, but it's explaining what you don't know for sure? Without completely rattling your patient's confidence? And that really gets to the heart of it. Medicine has this kind of unspoken challenge, which is the reality that uncertainty is just built in. It's an unavoidable part of healthcare. It's not a sign that something's wrong. It's just the nature of an ever-evolving science. Okay, so what do we actually mean by medical uncertainty? Well, it's pretty simple. It's just that state you find yourself in when the evidence is incomplete, or it's changing, or maybe it just doesn't perfectly apply to one specific person. It's really the gap between what we know from studies and what's true for you, right here, right now. And this uncertainty, it pops up all over the place. I mean, research is always ongoing, so guidelines are constantly changing. Plus, every single person's body is different, so we all respond to treatments in our own way. New therapies, they often don't have decades of data behind them yet. And sometimes you've got these complex conditions where the symptoms could point to a dozen different things. Admitting this isn't a weakness, it's just being honest. But this is where it gets really tricky, because when these unknowns aren't communicated well, it can lead to a huge problem: fear. And this is the moment where the art of communication becomes every bit as important as the science of medicine. And listen, this is no small thing. When risks are just thrown out there without any context, a patient's mind, well, it can run wild. They might start to totally overestimate a super rare side effect, or maybe they'll avoid a treatment that could genuinely help them. And worst of all, they can lose trust and end up carrying this heavy weight of anxiety that they really don't need to. Just look at this. A tiny little change in how you say something can make a world of difference. Saying, this medication has rare side effects, that's vague. It's kind of scary. But saying, this affects 1 out of 1,000 patients, now that gives you real perspective. You're turning this formless fear into a concrete, manageable number. All right, so how do we do this right? Let's actually put together a toolkit for framing risk in a responsible way. The whole goal here is to shift the conversation away from fear and towards clarity. And it really comes down to 3 key strategies. First, use absolute concrete numbers. Second, and this is crucial, always provide context for those numbers. And third, you have to present a balanced view of both the risks and the benefits. Let's dig into that first one, absolute numbers. Think about it. The word rare could mean one thing to a doctor who sees it all the time and something totally different to a patient. But a number like 1 in 1,000, well, that's the same for everybody. It gives everyone a shared, clear starting point and just grounds the conversation in reality. Okay, next up, context. A tiny risk from a side effect can feel huge when you look at it in a vacuum. But what happens when you put it next to the much, much bigger risk of not treating the disease at all? All of a sudden, the choice often becomes way clearer. Context is what gives these numbers their real meaning. And that third strategy is all about balance. A really good conversation isn't going to just fixate on the worst-case scenarios. No, it's going to clearly lay out the good things the treatment can do, talk about the possible side effects and how likely they are, and even bring up other options. This gives the patient the whole picture, so they can make a truly informed decision. Now, these tools are fantastic. They're super powerful, but they only really work when they're built on a solid foundation of trust. And that brings us to what might be the most important part of all of this, the human element. This quote, this just nails it. When a patient feels genuinely heard and understood, the entire dynamic of the conversation changes. That feeling of uncertainty, it stops feeling like danger. Instead, it starts to feel like a problem that you're both going to tackle together. And you can actually structure a conversation like this in 4 pretty simple steps. You start with what you know for sure. Then you're upfront about what you don't know yet. Third, you explain how you're going to make a decision in spite of that uncertainty. And finally, you reassure the patient that you'll be keeping a close eye on things the whole way. Because at the end of the day, these talks are emotional. They're not just intellectual exercises. Sure, patients hear the numbers, but what they feel is vulnerable. And that's why empathy just isn't optional. It means really listening, saying, I hear your concerns, and creating enough space for them to ask every single question that's on their mind. So as we start to pull all this together, let's zoom out for a second. What's the actual goal here? It is definitely not about pretending that we have all the answers. It's about aiming for something much more valuable. And you know what? This skill matters so much more than just in one doctor's office. In today's world, with public health crises and information flying at us from every direction, being able to clearly communicate how and why science changes is absolutely essential to keeping public trust in the whole system. And that's really the main thing to walk away with. The ultimate goal isn't to chase this impossible promise of 100% certainty. It's to build an unbreakable foundation of trust. Because, look, certainty might be a moving target, but trust is always, always within our reach. So I'll just leave you with this to think about. It doesn't matter if you're a patient or a healthcare provider, how can you use some of these ideas to build just a little more trust and a little more clarity in your very next medical conversation? Thanks for tuning in.